Well, we're going to try this again. So apparently I went offline, came back online. Um, all right, so we're going to start again. Welcome everybody. So this is our weekly Tuesday night webinar by Integrated Health Systems. As I was saying earlier, if you guys have been, hanging on with us, each Tuesday night we've been doing a webinar on different topics. So we've done concussions, we've done thyroid, couple different thyroid webinars. We've done things on anxiety, depression. Jake's been on here. Dr. Maynard has been on here. So we've just been rotating through. So next week, I believe, is Jake again, and Jake's going to talk about I think it's like three things that the coronavirus has done, or something like that. He's going to talk about mood and kind of the coronavirus and some of the things that's been kind of impactful on the patients that we've seen and people that we know. So I think it's definitely a good one to kind of tune in, let your friends know, let friends and family, those who are struggling. We're definitely noticing there's a lot of people that have been struggling, with the isolation and shelter in place and not be able to do the things that they love. So if you know anybody who's struggling, Jake's going to be on next Tuesday. He's going to talk about kind of what the coronavirus has done. If you kind of watch out for some of his information this month, we talked about really talking about re-engaging after coronavirus. So I think that's something that Jake's going to really touch on, is how do we re-engage with anxiety? So there's a lot of people that are very anxious about reopening, re-engaging back into the public. So again, if you know anybody who's kind of struggling with that piece, I think Jake's going to really touch on that next Tuesday's webinar, and also look for some of the blogs, Facebook articles, things that we're posting for you guys. But definitely check in with Jake. So today we're going to talk about irritable bowel syndrome. Like I was saying earlier, this is probably one of the most common things that we see people being diagnosed with these days. It feels like it's kind of a trash can diagnosis or a catch-all, where somebody has some gas and bloating and you can't really figure it out. It's like, oh, it must be irritable bowel. And so it's kind of what we hear a lot from patients that are just struggling. They don't know where to go. They don't know what to do. They don't know what to take. All they know is they have irritable bowel because that's what their doctor told them. And we'll kind of talk about the different types of irritable bowel. And I'm going to go to some of the causes. I'll talk about that. I'll talk about testing, some of the things to look at, and then also I'll talk about treatment and some of the things that you guys can do, maybe try on your own. So a little bit about me. So I know some of you guys know who I am, but if you don't, so my background, so I'm a board certified chiropractic neurologist and also a board certified chiropractic nutritionist. So meaning that, so I have postdoctorate degrees in those two. So I have two board certifications. And this is kind of about the practice. We really kind of integrate the neurology and the nutrition together, which is something you really don't see that often out there. And really, I started integrating the nutrition piece because of the neurology. So when you have somebody that has anxiety, for instance, what are the things that cause anxiety? Well, you can have hormones that create anxiety, blood sugar imbalances, stress, all these different things. So, I didn't want to be one of those neurologists that's like, oh, I'm just going to, work on everybody's anxiety, and not look at other causes. So that's, where I got my board certification in nutrition. I got a couple other degrees in nutrition as well. And also trained in TBI rehab or concussion rehab. So today, I've been practicing for 17 years. So it's kind of cool to actually change the number on my slide. So today is kind of the anniversary of being in practice for 17 years. So I've definitely learned a lot over the years. Things have changed over the years. Information's changed. It's just fascinating. When I was first in practice, nobody talked really about IBS. Nobody talked about SIBO. Nobody talked about, mast cell activation, all these different things. So there's a lot of things that have come, on the scene since I've been in practice. So it's kind of been fun to be a part of it, and it keeps you going. So you always have to strive to get better, stay better, and be on top of things. So we're going to talk about IBS, and I want to talk about some of the signs and symptoms to kind of get started with, which you see, and this is what's crazy, and that's why I say, like, you kind of find that IBS tends to be almost like this kind of catch-all diagnosis. It's kind of like fibromyalgia is a catch-all diagnosis, meaning that if they can't figure you out and you have a bunch of pain, we must have fibromyalgia. Or the other catch-alls tends to be like eczema. It's like, oh, you have kind of a skin rash we can't figure out, it must be eczema. So there tends to be some of these like diagnoses that are very easy, and they call them kind of catch-all. And this one's easy. If you kind of look at this, like abdominal cramping, gas and bloating, constipation, diarrhea. Even some people have a mix of constipation and diarrhea, so it just goes back and forth, back and forth. I do this on here because a lot of people don't even think about this, but like sleep disturbances can also be related to IBS. Anxiety is actually a big one. It's something I think gets overlooked quite often. I mean, just this week alone, I've had conversations with people, about their anxiety and IBS. And then lastly is fatigue. When you start having a bunch of gut issues, or you have a lot of constipation or what have you, it creates a lot of fatigue. And you kind of see a lot of these patients they're tired. I mean, they're kind of tired of the condition. They're tired because of the condition. They may not be getting their nutrients, so that's making them tired. They have anxiety all the time. That makes them tired. They're not really getting good sleep. That makes them tired. So you can see this kind of a lot of kind of very, in a way, generic type of symptoms, because I tell you what, there's so many people that have gas and bloating. I mean, almost every patient talks about that. Constipation, that goes with so many conditions, from thyroid to hormones to stress to brain injuries to neurodegenerative disorders to childhood disorders. I mean, constipation is on a lot of things. So is sleep. So all of these symptoms are actually kind of associated with a lot of other conditions as well. So to kind of say, well, hey, these are just IBS. I mean, that's hard to say. So we'll kind of break this down a little bit, and this is kind of where I'll go into some of the testing, and maybe this will help you guys out. Maybe some people were kind of watching this video going, oh my goodness, that sounds exactly like me. So if that is, then awesome, and we'll try to go over some things that you guys can try. Now, there's subtypes of IBS, and this is what I kind of wanted to show you guys. So it's really interesting. I mean, when they first came out, you hear IBS, and then it was IBD. So, patients come in, they're like, well, I know what's wrong with me. I have IBD. I'm like, great. So you have irritable bowel disorder, or you have irritable bowel disease. And then other people are like, I have IBS. And I'm like, great. So you have a bunch of symptoms, So now they've kind of classified these to IBS-D, IBS-C, and then IBS-A or M, which I like this alternating or mix. So it's actually a really constant thing to see this mix between constipation and diarrhea. And then you see IBS-PI, which is like a post-infectious IBS. So think about somebody that had like a parasitic infection and then ended up with IBS afterwards, or had you can have viruses, you can have parasites, you can have all sorts of things in your digestive tract. So post-infection is almost like you just didn't recover all the way, and now your gut's kind of a mess. And then there's IBS, which is PVD or post-diverticulitis IBD or IBS. And I've actually seen a couple of these cases, and it's kind of fascinating. Sometimes people have diverticulosis, which is where you have this little outpouching of your large intestines, and then diverticulitis is where it gets inflamed. So I've actually had a few patients that I've known that all of a sudden just boom, they didn't realize they had diverticulosis, but for whatever reason, they either had an infection in there or they got some food stuck in that little pouch and they ended up with diverticulitis, but it kind of creates this wicked, kind of inflammatory response. So afterwards, they end up having, IBS-like symptoms. So when we get into the cause, and actually this can kind of go on and on. So I'll talk about the causes, and I want to talk about some of the things that I see in the office. So I'll kind of start to your left of the screen, but we look at SIBO, and SIBO stands for small intestinal bacterial overgrowth. And then I put / leaky gut, because you kind of see leaky gut with almost everything. Now, if you haven't heard the term leaky gut before, sometimes you get this kind of weird imagery of things leaking out of your digestive tract, and that's not really the case. It's a little bit weird. But what leaky gut is kind of imagine, you're looking at your neighbor's yard, and they have this really cool fence, right? And actually, my neighbor, so I'm kind of using this because my neighbor actually put up this gorgeous fence just the other day, so it looks nice, and everybody's kind of jealous because it's clean and everything like that. Now, if you look at another neighbor's yard, and where they didn't take care of their fence, what happens is you're seeing some missing fences or pickets, right? So now you have kind of these holes in the fence, and in that hole, now you have, a cat can go in and out, a rabbit can go in and out. Hopefully the hole's not too big, the dog doesn't get out. So these are kind of what is a good analogy for a leaky gut. So you actually have these same kind of like picket fence types of things in your digestive tract, and what they do is they keep all the, they call it macronutrients or macromolecules out. So you don't need, broccoli crossing through. You don't need eggs and potatoes, crossing through the fence. What you need is like the amino acids and vitamins, vitamin C and D and magnesium and all these different things. That's what you need to cross back and forth. So when the picket fence gets really big, then you start ending up with a lot of what they call leaky gut, which then creates a ton of inflammation. So inflammation in general causes leaky gut. So you can see like IBS, people with IBS have leaky gut. Stress people have leaky gut. If you have an autoimmune condition, you probably have leaky gut. There's tons and tons of research now on traumatic brain injuries and leaky gut, auto accidents, leaky gut. So it's kind of like it's almost a given anymore. So the more that you kind of like research it, and all the patients that we see, it tends to be kind of a catch-all, or not a catch-all, but really common to see. Now, SIBO, I'll kind of give you some of the thoughts around SIBO really fast, but I mean, I can do a whole entire lecture on SIBO. Matter of fact, I actually give 2-hour lectures to other doctors on SIBO, and I do whole one-day seminars on just digestive function. So SIBO is a kind of a big topic, but here's the things with SIBO that you might realize. People with SIBO tend to talk about how they get gas and bloating that increases throughout the day. Many patients over the years will say, "Hey, I look like I'm 7 or 8 months pregnant by the end of the day." Um, Even talking to a patient that the gas and bloating gets big enough that she actually has like different pants sizes when she's bloated. So bloating can be really minor for some people, and bloating can be a lot. But kind of with SIBO, you see that a lot of people have with SIBO, they have the gas and bloating that increases and gets worse as the day goes on. So there's kind of one kind of big typical signs and symptom that you see with SIBO. The other one that people don't even realize sometimes is that you hear every once in a while somebody go, "Oh yeah, I took a probiotic and it made me worse." And the reason why that makes you worse is because if you have a lot of bacteria that's in the small intestines, and then you add in probiotics, it actually kind of adds to the population. And so what they do is, you got all these bacteria, they're sitting in the small intestines, and they're kind of like eating your food, so to speak. And they should be hanging out in the large intestines where they're supposed to do their job. And there's actually this whole world of like bacteria in the gut is huge and really fascinating. They call it the microbiome. So they're looking at all these different bugs and their different roles within physiology and the immune system and even brain function. Super fascinating. But when these bugs go from the large intestines and they kind of hang out in the small intestines, then that's when you get SIBO. So by adding some more probiotics, you're just kind of adding to the overgrowth. So you'll hear a lot of people go, "Oh yeah, I took probiotics once and I did not do well with that." So with SIBO, the last thing that I'll kind of mention on here is you can actually have some bacteria that produce methane and they cause constipation. And then you have certain bacteria that produce hydrogen and they create diarrhea. And then you can have both species. So you can have methane producing and hydrogen producing that give you both the constipation and diarrhea. So a lot of times I've seen a lot of the IBS be actually SIBO related. And people say, "Oh yeah, I have this mix of constipation, diarrhea, and I get bloated as the day goes on." I'm like, "Ugh, that kind of sounds like SIBO." So that's why I wanted to put that one and kind of talk about it first because it's 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 one of those conditions that since I've been in practice, SIBO has definitely come along. I think there for a couple of years, it seemed like everybody was diagnosing all their patients and all their dogs, with SIBO. And I think that's finally calmed down a little bit, and they're kind of identifying here's things that really sound like SIBO that we can kind of pinpoint. I also put on their food allergies. Food allergies, uh, those can definitely cause a lot of IBS issues. And people say, "Well, I don't eat something all the time, whether it be like dairy, but you can eat dairy and have a reaction that can last 5 days, 7 days, couple weeks. I mean, everybody's a little bit different, but you can have, kind of IBS symptoms from a food allergy that people don't really like put two and two together because they don't eat it all that often, but the ramifications are very long lasting. So we definitely look at food allergies with a lot of our patients. On the right side, I put your fight, flight, or freeze syndrome. And this is kind of where we get into the neurology piece and also into the counseling side of things. I can tell you the number one thing that I've seen over the years is anxiety. I see a ton of people with anxiety that have digestive issues. And so if you think about it, anxiety is a fight or flight mechanism, where digestion is a rest and digest mechanism. So if you're constantly in a fight or flight mode, then your digestive system just doesn't work. So you can actually see constipation because now your motility is gone down. So the movement of your food is decreased because you're in a stress response. And so if your food motility or the motility of your food decreases, then what happens is you become more and more like constipated because you're pulling the moisture out of the stool. And so the longer it sits in there, the more you're just pulling the moisture out, and it becomes very, very kind of hardened. And that motility starts to slow down. And so people just get backed up, and then sometimes your body tries to flush it all out, but then it flushes it out. You get dehydrated, so then it tries to hold back, and then that's where you start just getting this alternating back and forth. So one of the things that I really impress upon you guys is if there's some anxiety or if there's trauma in your past or in your history, these are definitely things to address and look at. And I'll talk a little bit more about that later. But we all have stress. Definitely with COVID and people losing their jobs and losing their businesses, losing family members and friends. There is just so much stress right now in our world that I'm not going to be shocked if we start seeing a ton of IBS coming through in the next couple months. It's just hard to get away from that. So that's just something, just good to kind of tell you guys. With the whole coronavirus thing right now, we're definitely kind of hearing, a lot of people, have the stress. Plus, they're not as active, so there's a lot of people not doing much, and they've been in their house for, 7, 8 weeks now. We've actually heard people have just never even left their house at all. So it's just, when you don't have a lot of movement, that's not so great for you as well. And then you're living in stress, so some of these things, I think we're going to start seeing some of these conditions start to come through a little bit. So if you're one of those people, definitely moving is great. Going for walks, going for hikes, ride your bike, get out and move, because I think those are some of the things that are going to keep us going and keep your stress under control as best you can. Now, I put down autoimmune conditions because I tell you what, I've even heard that IBS, some people actually label IBS as an autoimmune condition. So we look at things like Crohn's disease, ulcerative colitis, celiac disease. So these are some of the big things that people don't really talk about. They say, I have all these symptoms, and then they don't really get tested. Nobody like double checks, and they just go, oh, you have IBS. But then if you actually dig deeper and you do some blood work or some testing, you kind of find out, oh my gosh, they actually have ulcerative colitis. This is why they have all these symptoms. So these are kind of just, like I said, a few. There's so many different causes of digestive issues. We haven't even gotten into parasites, different bacteria, candida, viruses. These are all your post-infectious. And so there's actually ways of testing those that I'll talk about here a little bit. So I kind of want to talk about this. This is our exam. This is what we do on our examination. So I say this because I think if you're looking for a doc, find a doc that's kind of really good at evaluating each person, because what you kind of find with IBS is not a protocol based, condition. You definitely see a lot of clinics out there that are like, oh, I have the IBS protocol, and they kind of name it and they market it and they do all these things. And at the end of the day, if it was that easy, going to work would be less stressful. Even today or yesterday, I had a conversation with a patient, and we've been working on her stuff, and she's been a trooper. She's been fighting through trying to fix her IBS for, oh my gosh, decades. It feels like, I think it's been close to 20 years. So we've been working on that, and it's like, if it was super easy, it'd have been awesome, but it's not. So I think to have an examination process is important. So I think, you want to find somebody who will do these kind of things, like a detailed history. You want to look at personal history and trauma. You want to look at mental health. You want to look at like accidents, auto accidents, slip and falls, concussions, things like that. So that history becomes really important to identify, where's this coming from? Laboratory testing, and I'll go over that. So you can do things like stool testing. There's blood work, imaging that you can do to try to figure out what's wrong. And then I put on here a detailed exam. With our office, we do a detailed exam on every patient because I think it's important to see, is there a neurological component to this? And if there's not, then great, I can cross that off the list. But if there is, that could be huge. The thing is like Parkinson's disease. Some of the earliest signs of Parkinson's disease is constipation. Some of the earliest signs of Alzheimer's is constipation. So for us, it's important to say, I want to make sure that you're not, we don't have a 50-year-old person that's been dealing with like constipation, losing their smell, and maybe we're actually looking some early Alzheimer's that we can nip in the bud or start working towards. So this is why in our office we always look at more like a very detailed, comprehensive type of evaluation, so that we can kind of figure out, okay, where's this coming from? Who are the players? What's the contributing factors? And then we can put a game plan together. So I can talk about some laboratory testing. And it's really simple. I showed you a couple of things here. So this is what your SIBO test, and what they call this is a hydrogen and methane breath test. And so what you do is you blow into a bag, and then they measure out how much hydrogen and methane are in the system. And so by this, they can actually tell, like, is this why you have constipation? Is this why you have diarrhea? Or is this why you have kind of a mixed bag of each? And then you can do like pre and post testing. So this is kind of like one thing that you can do for small intestinal bacteria overgrowth. This next one is another stool test by a company called Genova. And what they do is we can actually look at like digestive health. So I'm just showing you like a screenshot of a patient that we ran just recently. But we're looking at like pancreatic enzymes. We're looking at how well they're breaking down their fat. So if you see like your stools float all the time, that tells us that there's some issues going on with your digestive system where you're not breaking down the fat. So it's mostly in the stool, which makes it float. You can kind of see at the bottom, we can look at inflammatory mechanisms and immunology. So this patient has what's called like secretory IgAs that are elevated. So basically what it tells me is that her immune system is kind of on high. So it's definitely, it's ramped up there. It's on guard. And one of her biggest complaints is actually gas. So she has gas like all day, all the time. So she has a lot of inflammation that we're actually working on calming down right now. So kind of to go further, we can look at things like the microbiome. So the microbiome is looking at those bacteria. And what you find is there's actually certain food and fuel sources for all the different cells in the microbiome. And these are things that people are now starting to talk more and more about. So short chain fatty acids, something that people have talked about, but now there's definitely more and more research that's coming out about short chain fatty acids and how they support what's called the colonocytes. So that's all the cells in your colon. We also look at things like glutamine that actually supports the cells in your small intestine. So the microbiome are really beneficial from a short chain fatty acid support. So these are some of the things that you'll see. So if you're kind of like geeking out and you're listening to different webinars or different podcasts and stuff like that, you'll probably hear short chain fatty acids being talked about more and more and more in this microbiome. When I first started off, it was kind of like microbiomes coming on the scene and people were talking about it, and now it's just exploded. And it's exploding so fast. It's kind of been a little bit tough to keep up with because just everybody keeps pulling apart different aspects of the gut bacteria and what they do and their role in health. So super, super fascinating. You'll see things at the bottom like beta glucuronidase, so we can get some ideas of how well people are breaking down things. It gives us some ideas of like even hormones, which is kind of cool. So kind of showing your gut to hormone connection. This is looking at different bacteria species. So we can see some people like this patient here had just way too much. So you see a lot of highs all the way through. So she has a lot of bacteria that are hanging out. And so definitely more than she needs. So sometimes you'll hear another term called like dysbiosis, which means abnormal kind of bacteria. So this is looking at more of those different kind of bacterias and kind of the highs and the lows. And it's just so these things kind of give us a lot of data, and that's kind of what we need sometimes with patients where they're like, I'm just a mess and nobody knows what to do with me. So we start kind of breaking this down and trying to find out, okay, where at in the digestive tract are they really struggling? So some other testing here. So I wanted to list some other tests because you'll see a bunch of different ones out there. But antibody testing is something that if you're suspecting like Crohn's, colitis, celiac disease, your antibody testing is actually what kind of helps identify those. So you can always ask your doctor, hey, can we do antibody testing for my gut? And some will, some won't, but it kind of gives you an idea. It's kind of like what everybody's hearing with like COVID right now. Everybody wants the antibody testing to find out have I ever been exposed to COVID? That's what antibodies do. They let you know, like, is this a process that's going on? Do you have an exposure to this? So if you have an autoimmune disease, then you should have the antibodies to kind of show that. Now, CT scans, I actually ran one a couple weeks ago on a patient. So CT scans will tell you if there's things like diverticulitis, if there's constipation, if there's different like autoimmune diseases where they can kind of pick those up on imaging. So it's kind of really your detailed image. So that's your CT scan. Ultrasounds can be great if you're looking for certain things like appendicitis. So they all have like different rules, and hopefully your doctor kind of knows the different things to do. And then the last one is an endoscope. So where you can actually kind of scope down, you can even do a scope up. So you can go through the mouth or, up, from the bottom. And you can really kind of look and say, okay, is there what they call like skip lesions? Are there, polyps? Actually, we had a patient that, was diagnosed with, some ulcerative colitis, like towards the rectum area. So that was kind of found on a scope. So there's different things, and all these testings have their specific role. That's why you have to do a very detailed history. So this is where you want to find a doc who's kind of good at just being thorough and then kind of identifying, okay, here's the best test to identify where do we need to go next. So I want to kind of show you, these are a couple of our neuro exams that we do. So we do this called like VNG testing, where we look at eyes. And eyes are really important. We can look at eyes. We can get an idea if they have, somebody has some anxiety. We can get an idea if there's some like breakdown in their brain. We can look at things like vestibular function. I mean, believe it or not, all these different areas of the brain play a massive role into what's called like the vagus nerve. So you can actually have a neurological component to IBS, and we actually will sometimes use like vagal stimulation. We'll use vagal exercises. We'll do different types of vagal therapies just to activate that gut. So the connector between your brain to gut is actually through the vagus nerve. So we a lot of times we look at that vagus nerve, we test it, and then we try to say, is there other things that are influencing this, like the brainstem or the vestibular system or the frontal lobe? What are all the different pieces that are playing a role within the system? So again, we can look at balance testing. It kind of gives us an overall picture of the person. And then we always do a pretty good neurological exam. So we're always, looking at different types of reflexes and sensory, motor, balance. And so we're trying to get the whole picture on people because, IBS can just be a lot more than just being in the gut. So, I think the word holistic is definitely looking at the whole person. So we look at the brain and the body together. So I wanted to kind of leave you with some like things like, what do we do? Like, what can you guys do? So I want to give you some things that we can do to kind of get started. Here's a couple different options. Dietary changes are pretty important because you could be eating something that could be causing all these issues and you don't even realize it. A lot of people assume that what would cause IBS is something bad, like wheat, gluten, dairy, soy, all these things. But man, you could have reactions to turkey, to lettuce, to broccoli. You can have other things that your body's having a reaction to, and through that reaction, then you're creating this constant inflammatory response. And so this is why you do see some practitioners get into like food allergy testing, which could be good. I usually don't do food allergy testing until I get that gut healed up. Because usually people have leaky gut, have a lot of food allergies. That's just kind of the name of the game. So at the very least, you eliminate allergenic and inflammatory foods. So these could be like your genetically modified foods like soy and corn. You got your hybridized foods that there's a lot of controversy on, like wheat. Dairy is pasteurized, so some people don't do well with that. Eggs is kind of another allergenic food. Your nightshade vegetables are allergenic. Some people don't do with lectin foods. So when you start looking at what goes on out there in the public, I mean, you got people who do like lectin diets, intermittent fasting, paleo diets, autoimmune paleo, FODMAP, GAP, all these different types of diets. And this is why you see this, because different people kind of take these different allergenic foods and they kind of turn into like a protocol per se. So there's kind of like your common allergenic foods that I would say, hey, look into these things, like corn, wheat, soy, dairy, nightshades, eggs. Those are kind of the most common ones that we see, within our patients. I put on here paleo diet and autoimmune paleo diet. So if you look these up, you'll see basically they're no grain diets. When you get into autoimmune, it's a little bit more strict. So it'd be like no grain plus, no lectins, no nuts, no beans, no seeds, because some people do react to those. And then you have a FODMAP diet, which is taking out all the fructose-based foods like garlic and um, just lost some of those foods in my head. But garlic's probably a big one. But you have some of these actually vegetables that have fructose in them. You have fructose foods like your oranges and pineapple and stuff like that. And so some of these bacteria that are in the stomach will actually live off of those sugars. So that's where a FODMAP diet can come in. And you'll read about low FODMAP, high FODMAP, medium FODMAP, and then now people are starting to get into like autoimmune paleo FODMAP. It gets a little bit nutty. So that's why it's good to have somebody kind of guiding you through these, because what we found is that definitely every person is different. So just a one size fits all is not really kind of the name of the game. Supplemental support. So I wanted to kind of give you guys a couple things to look at. The first one is glutamine, and I was even having a conversation today with a patient, and I hear this a lot where people are like, "Oh, I take glutamine." I'm like, "Great, how much do you take?" And they usually say like either 1,000 milligrams or 2,000 milligrams is about the most common thing I hear. But if you look at the research and kind of what I've known all these years is that they say about minimum of 5,000 milligrams is what you need. So we always start at like, we do no less than 5 in the office. We'll even get up to like 7,500 each day. But you got to have enough glutamine in there to kind of start healing up the gut and to start supporting those cells. Other things like aloe is really good for like healing, the digestive tract, and you'll see these like in a lot of these supplemental supports and digestive supports. Digestive enzymes can be really good. So you'll see things like protease, lipase, amylase. So whenever you kind of see that ASE at the end of a word, like lipase, like lipids, fats, those things break down fat. Proteases, they break down protein. Amylases, they break down carbs. So a lot of these digestive enzymes help to kind of pre-break down those foods, which can help, when you're having some digestive issues. So it all should be temporary as you're kind of working on the gut. Now, I know I put in there probiotics, and probiotics can be good or bad. So, if you take a probiotic and it just makes everything worse, it's probably confirming that you most likely have small intestinal bacterial overgrowth. But for some people, different probiotics and actually supporting that system could be a really, really great thing. So most of the research that I read a long time ago, and I've kind of stuck with it, and it kind of changes, and it seems like everybody has their own opinion. But overall, what I kind of saw over the years is that about 100 billion a day is kind of a good therapeutic dosage. So this is where you get into the different types of probiotics, the different companies, the different dosages. So we tend to stick to companies where we can high dose without giving them like 10 pills a day. So we'll try things like that. Ginger is good. Fiber, I put like guar gum, pectin. Some of these different fibers can be really beneficial to your digestive system, trying to help get things moving. So fiber is a good thing. There's two different types of fiber. There's what they call like insoluble fiber, and then there's soluble. And the insoluble fiber is kind of like mixing, straw and mud together, you know, and that's your soluble. So your body can take it and break it down and use it, and it gives you that bulkiness of your stool. Where insoluble fiber, your body doesn't do much with it, but it can help kind of move things through. So this is why an apple a day keeps the doctor away, because your apple has both soluble and insoluble fiber. So that's really good. Where like a watermelon doesn't really have that. Watermelon is just kind of a lot of sugar and water. So apple is much better for you. A pear is really good for you because of the fiber and the both insoluble and soluble fiber. Now, I put on here some other things for like anxiety. You can look at like different GABA supplements. Sometimes those can be beneficial for some people. GABA kind of helps to calm down the anxiousness and stress responses. But things like kava kava, lithium orotate, L-theanine. These are some of the GABA supplements that you can use to help support calming down that stress response. And then adrenal support, so if you do have a lot of stress, there's some really good adrenal supports. And they all do different things, but you want to look for things that are more what they call like adaptogenic. So adaptogenic herbs can really be beneficial because they don't push your physiology in one way or the other really fast. So they actually are more supportive. So you can take adaptogenic herbs before bed. You can take it when you wake up. You can take it between meals. So I would probably say this is probably the safer bet to try. And then finally, some anti-inflammatory products like turmeric, resveratrol, glutathione. Those are some really good things to settle down that inflammatory system that's in the gut. And then finally, I want to give you some neurological supports. So these are some simple things, but like stress reduction, some of the stress reduction techniques are good. Visualization, meditation, exercising. Like I was saying earlier, go for walks, ride your bike. You can do things to actually get that, calm down the stress response, but also like activate your brain and get your brain working because your brain actually controls some of your gut function too. So if we're getting our brain working better, we have better gut motility. I put on here some different things like rose-colored glasses are really good for kind of calming down stress responses. Blue blocking glasses are really good for screens. And then at the very end, I was like, oh, we should probably reduce the screen time. So, I think with everybody working from home right now, you're definitely seeing a lot more screen time. Kids are getting more screen time. So we're inactive in front of our screen, stressed out. So this is why I think we're going to start seeing a lot more kind of digestive issues coming up. And then mental health, if you guys are definitely dealing with like anxiety, depression, and some of these pieces, get help for that. There's no need to let that fester. So get some counseling. There's things like mindful meditation. I know Jake teaches that. Journaling. Get a community. You got to have friends. So isolation, I think, is really hard on the human person. So you want to get some community going. You want to get your friends and family, loved ones. Even right now, if you can do social distancing, I've seen people in the yard, measured out all their stuff 6 feet apart, and everybody's hanging out listening to music. So community is really really important. And then Jake, Jake's in the office. I kind of mentioned he's been doing webinars on Tuesdays as well, so he'll be up next week. But definitely check out Jake. He's a great counselor. He's done some really awesome work. Um, Super smart dude. So you guys will like him. All the patients really seem to love him. They get along with him really well. So he's just been a great addition to the office. So my conclusion, act sooner rather than later, it's never too late. You can always work on stuff. So just because you've had something for 10, 15, 20 years doesn't mean that you can still work on it. If you guys are interested, we do free 30-minute consultations all the time to see if something like this would be a great fit. So, don't hesitate to call the office, so you can reach us on, through email, through Facebook, Instagram, LinkedIn, you name it. There's so many ways to get a hold of us. You can get a hold of us through our phone number, 303-781-5617. You can also listen to us on the radio. So every Monday, so we're on the radio. So today I was on the radio. So I talked about IBS a little bit. So it's kind of been fun. So every Monday we're taking turns on the radio talking about different topics. So, definitely reach out and listen, and you can even text questions if you want, and we can answer them online or on the air. So if you guys are interested, it's, KLZ, the source, so 560 AM and 100.7 FM. So every Monday we're on there, letting you guys know about different health issues. So we do telehealth. So if you guys are interested in this, we definitely have telehealth available. We're doing quite a bit of it. I think it's been great for the patients, especially during the COVID, shelter in place has been super convenient for the patients. So finally, if you're interested, call up, for your free consultation. We can definitely get that set up with myself or Dr. Maynard or Jake. So you guys can do a free consultation with Jake too and find out if, the mental health side, if he would be a good fit, because not all counselors are good fits for everybody, but it's a good way to find out. So I appreciate you guys. It's been great every Tuesday, doing webinars from IHS. And so every Monday we're doing the radio show. Every Tuesday we're doing a webinar, and then we're putting out blogs and articles and things like that. So we're just, really trying to stay out there for you guys, give you guys a ton of information, and hope you guys are enjoying it. So I hope you enjoy the rest of your evening and your weekday, and I look forward to seeing you at the next webinar. If you guys need anything or have suggestions, want a topic, definitely reach out. We're always up on it. We can talk on just about anything, since I lecture all over the place and been doing it now for 13 years. We got quite an arsenal of information we can share with you guys. So we're here if you need us. If you need a free consultation, great. If you're an existing patient, you need anything, holler. But we love you all and hope you guys are staying safe and healthy, and we will talk to you all soon.